Imagine losing a limb, but still feeling it as if it were there. You might experience sensations like itching, pain, or even movement in a part of your body that no longer exists. This phenomenon is known as phantom limb syndrome, and it's a compelling reminder of how complex and mysterious our brains and bodies can be. Today, we're diving into what phantom limb syndrome is, why it happens, and how it reveals fascinating insights into the way our minds perceive our bodies. Phantom limb syndrome is a condition where individuals who have lost a limb still feel sensations in the missing part of their body. These sensations can include itching, pain, or the feeling that the limb is still there and moving. Despite the physical absence of the limb, the brain continues to generate sensations that are perceived as coming from the missing body part. This condition is surprisingly common. Studies suggest that up to 80% of people who have undergone an amputation experience some form of phantom limb sensation. The sensations can vary widely, from pleasant tingling to painful cramps, and they can persist for years after the amputation. To understand phantom limb syndrome, we need to explore how our brains and bodies are wired to perceive sensations. Neural representation. Our brains have a map of our body called the sensory homunculus, which represents different body parts in the brain's sensory cortex. When a limb is lost, the part of the sensory cortex that used to receive input from that limb doesn't immediately disappear. The brain continues to process signals in the same way it did before the amputation, leading to the sensation that the missing limb is still present. Reorganization of the brain. After an amputation, the brain undergoes a process called neural reorganization. The areas of the brain that once represented the missing limb might be taken over by neighboring regions. For example, the brain area that used to process sensations from the hand might start processing sensations from the face or arm. This reorganization can contribute to the feeling of a phantom limb. Mirror neurons and sensory feedback. Research suggests that mirror neurons, cells in the brain that activate both when we perform an action and when we observe someone else performing the same action, might play a role in phantom limb syndrome. When individuals see or imagine movements of their missing limb, their brain might create sensations to match these visual or imagined movements. Psychological factors. Emotional and psychological factors can also influence phantom limb sensations. The experience of loss and the adjustment to life without a limb can affect how the brain processes sensory information. Psychological stress or trauma related to the amputation can sometimes exacerbate phantom limb pain or sensations. One of the most challenging aspects of phantom limb syndrome is phantom limb pain. This type of pain is felt in the area where the missing limb once was and can be severe and distressing. Phantom limb pain can range from a dull ache to sharp, stabbing sensations. Causes of phantom limb pain. Nerve damage. Pain might be caused by damage or irritation to the nerves that were severed during the amputation. These nerves can send pain signals to the brain even though the limb is no longer there. Changes in brain activity. The brain's reorganization after amputation can lead to abnormal neural activity, contributing to the sensation of pain in the missing limb. Emotional and psychological factors. Feelings of frustration, sadness, or trauma related to the loss of a limb can heighten the perception of pain and make it more difficult to manage. Managing phantom limb syndrome, especially phantom limb pain, can be challenging. However, several approaches have been found effective. Mirror therapy. This technique involves using a mirror to create the illusion that the missing limb is still present. By performing movements with the intact limb while watching its reflection in the mirror, patients can sometimes reduce phantom limb pain and improve their sense of control over the missing limb. Sensory re-education. Techniques such as sensory re-education can help retrain the brain to process sensations differently. This might include exercises that focus on improving sensory feedback from the remaining limbs or using prosthetics. Medications. Pain management may involve medications such as pain relievers, anti-seizure drugs, or antidepressants. These can help alleviate phantom limb pain and improve overall comfort. Psychological therapy. Counseling or therapy can help address the emotional and psychological aspects of phantom limb syndrome. Cognitive behavioral therapy, CBT, and other therapeutic approaches can support individuals in coping with pain and adjusting to life after amputation. Prosthetics. Modern prosthetics can provide sensory feedback and improve the functionality of the remaining limb. Some advanced prosthetics are designed to enhance the sensation of touch and movement, which might help reduce the intensity of phantom limb sensations. Phantom limb syndrome can significantly impact daily life. The persistent sensations or pain can affect physical activities, mental health, and overall quality of life. Individuals with this condition might find it challenging to engage in activities they once enjoyed or to adapt to new ways of performing tasks. Support from healthcare providers, family, and support groups can be crucial in managing the condition and improving the individual's quality of life. Education about phantom limb syndrome and access to appropriate treatments and therapies can help individuals navigate the challenges associated with the condition. Phantom limb syndrome has provided researchers with valuable insights into brain function and sensory perception. For example, studies have shown that the brain's ability to reorganize itself and adapt to changes can offer clues about how sensory information is processed and how pain is experienced. Researchers are also exploring new treatments and therapies based on these insights. Innovations such as virtual reality and neuroprosthetics are being investigated as potential ways to manage phantom limb syndrome and improve outcomes for individuals experiencing this condition. Hearing from individuals who live with phantom limb syndrome can provide a deeper understanding of the condition. Alice, who lost her leg in an accident, describes her experience. "Sometimes I feel as if my leg is still there, and I can almost move it. It's strange and a bit unsettling, but I've found that mirror therapy helps a lot." John, who has experienced phantom limb pain, shares his journey. "The pain was intense at first, but with medication and therapy, I've been able to manage it better. It's a long process, but understanding that others experience the same thing has been comforting." Phantom limb syndrome offers a fascinating glimpse into the complexity of our sensory systems and the brain's ability to adapt to significant changes. Although it can be challenging to live with phantom limb sensations or pain, there are effective treatments and strategies that can help manage the condition. Understanding phantom limb syndrome and seeking appropriate support can make a significant difference in coping with the sensations and pain associated with this condition. By embracing innovative treatments, seeking emotional support, and exploring new research, individuals can find ways to improve their quality of life and better manage the challenges of phantom limb syndrome. So, the next time you hear about someone experiencing sensations or pain in a missing limb, remember that phantom limb syndrome is a real and intriguing phenomenon that highlights the incredible ways our brains and bodies work together to perceive and interpret the world.